All right. Good evening, everybody. So, welcome to the Road to Residency. Tonight, we're going to be talking about ARIS applications and focusing on meaningful experiences and program signaling. So, I am Dr. Sarah Eickmeyer. I am the chair of PM&R at University of Kansas, and I will be facilitating tonight as part of my work on the Medical Student Educator Council. So I'm going to go ahead and have our panelists introduce themselves, and we'll jump right into the questions. So first up on my screen is Dr. Elwert. Go ahead and introduce yourself.
Yeah, hey everyone, good evening. My name is Dr. Elwert. I go by Dr. Nick. I am at the University of Kentucky, where I am our APD and clinically focus on stroke rehab, both inpatient and outpatient.
All right, welcome, Dr. Elwert. Dr. Lamb, you're next.
Hey everyone, I'm Dr. Adam Lamm. I'm the program director at Mary Free Bed in Grand Rapids, Michigan. I'm also the division chief at the Michigan State University College of Human Medicine. Been in that role for 3 years now. Clinically work in brain injury and concussion care.
All right, thank you, Dr. Lamb. Dr. Williams, you're up next on my screen.
Hello, my name is Maida Williams. I'm a third year PM&R resident at the University of Minnesota, and I'm in the process of applying for cancer rehab fellowships.
Excellent. Hey, we have one of those at Kansas. Just have to put a plug in. Shameful plug. All right, Dr. Romonoski, you're next.
Good evening, everyone. Natasha Romonoski. I'm the program director at Penn State Health in Hershey, Pennsylvania. I do a little bit of everything rehab, and I did some research on signals when it first was started in our specialty. So big advocate and looking forward to chatting with you guys tonight.
Wonderful. Thank you so much. Dr. Ayon, up next.
Hey guys, I'm Siam. I am a PGY2 here at Burke Rehabilitation Hospital. I too am interested in cancer rehab.
Oh ho ho. I'm going to be recruiting. All right. Dr. Hampel, you're next.
Hey everybody, I'm Dylan. So I just finished my intern year up here in Northern California, a TY program, graduated from ASCOM in Arizona, and going to be with Dr. Morales here at UC Irvine PM&R very, very soon in a couple of weeks, and planning to pursue brain injury medicine. So happy to see you all.
Wonderful. Thank you. All right, Dr. Morales.
Hey everyone. As mentioned, I will be next year at UCI. So, my name is Jose Morales, as you guys can see. Currently, right now, I'm in Hemet, so SoCal. It's a TY program out here. So far, it's been a good experience out here. So, can't complain. Been able to stay in Southern California for the most part. But yeah, I'll be in Irvine next year or within the next few weeks. And then interested in pain at the moment, but definitely keeping my eyes open for all the possibilities out there. So.
Great. All right, Dr. Molinares.
Good evening, everybody. I'm Diana Molinares from University of Miami. I'm the program director at University of Miami for PM&R, and up to very recent, the program director of cancer rehab. So I also put in a plug there. So excited to hear people interested in the field. And the director of cancer rehabilitation services for the University of Miami.
Thank you so much. All right, Dr. Fanis. A familiar face.
Oh, I'm just listening as a med student.
All right. And is that anybody else on our panel tonight? Dr. Dragojlovic, I saw you jump on.
Yep. Sorry I'm late. Hey everyone, I'm Nikola Dragojlovic. I'm the program director at UT Health Houston.
Okay. All right. Well, I'm going to jump into questions. And as a reminder, the chat is open, so feel free to put questions in there as well. We're going to be just kind of going through questions that were submitted to the panel ahead of time. First, we're going to talk about program signaling and geographical preferences. Before we jump into the questions, can one of the program directors maybe just give an overview and kind of anchor us in what, program signaling and geographic preferences are and kind of what they mean to the programs?
Sure, I'll take that one. So program signals are a way for applicants to notify programs at the time of application of their interest in interviewing with that program. Okay. In PM&R, when you apply to our specialty, you get 20 program signals to use. And you'll select those 20 programs that you want to send to whichever PM&R programs are your choices, or your top 20 choices. And residency programs will be able to see if you signal them. So it's a way for you as an applicant to express interest in a program above and beyond just applying. And it's a way for a program to know that you have a heightened interest in them. Geographic signals work in a similar fashion. They allow you to select from up to 3 regions of the United States where you are most interested in doing your training. And programs can see those geographic signals. Now, if a program does not reside in a place where you selected a geographic signal, they will not see the signal. The program will only see it if they're in that region where you signaled. Same with a programmed signal that you send to Dr. Elwert or Dr. Romonoski. I can't tell that you signaled University of Kentucky or Penn State. I could only see if you signaled us at UT Health Houston, right? So it's a sort of like a confidential but very clear way for you to indicate interest in a particular program or a particular region. Increasingly, because of the competitiveness of PM&R, we're seeing residency programs use signals as a way to better select applicants that they know are interested in their program or interested in staying in the region where they are taking care of patients or have their hospital sites at.
All right, thank you for that overview. So I'm going to jump into the questions, and there's one question about how does your respective programs interpret signals from students who also complete an audition rotation with you? Is a signal necessary even if you complete an audition with that program? What do you guys think?
So I guess, go ahead.
I was just going to pop in and say, if you enjoyed your audition, then yes, it is imperative. And if it's not somewhere that you want to spend a limited currency you have on, then probably not, as someone who just did that last year.
Yeah, I think that's really good advice because, right, if you do an audition rotation at a place and you do not signal that program, then you are telling that program that they are not in your top 20. So that would indicate that you probably did not have a good experience, right? And so, there was, back in the day when you had like 4 signals or lower number signals, I think maybe there was a different discussion around this, but I've been pretty adamant that if you had a good audition rotation and it is a place that you want to end up at, then you should signal that program.
I was one of the people, since I applied in 20, I'm going into my 4th year, so I think 23. I had 4 or 5 signals. I think it was the 2nd year that they were doing signals. And so I'm not an expert on that with the 20 signals now, but I can say I'm a chief resident at my program, and not signaling a program is a clear, like, and you're ranking someone that didn't signal you. If you do that, it's kind of like, oh God, like, is that a wasted rank? I won't give away Minnesota's secrets, but it definitely like does weigh in on those conversations.
I would also remind applicants that signals were created to help you and were implemented to create equity amongst applicants. And we understand that some applicants don't have the opportunity for an away rotation. Maybe you have a home program. Maybe you don't have a home program. Maybe you don't have the financial ability or travel resources. So we really want to encourage people to utilize signals for places they have interest, whether or not you rotated there, to try to ensure equity amongst applicants. And just piggybacking on everything else, the signal is for you. So if you enjoyed that rotation and you'd like to end up there, I would encourage using a signal. But that's not to say that you have to. If you feel like that's maybe not one of your top 20, then that's, a separate discussion.
So another question is, how do the number of signals work if one is also applying to internal medicine preliminary years? So who wants to take that one?
I can take that one. So your PM&R signals of 20 are only for your PM&R programs. And so if you're applying to any other specialty that also allows for signals, you will get a separate quota of signals that you can use for that particular specialty. So transitional years being one, other specialties being others. If you're an applicant who's deciding to dual apply, you get the number of signals that that specialty allows for however many specialties or TYs you're applying to.
And there's a separate but related question to that. If someone wants to touch on what it means to apply for a preliminary position versus transitional year versus internal medicine or surgery intern year, like how are those viewed, or what is the advice on that? Maybe from some of the residents who might have done different versions of those intern years.
So I did a preliminary internal medicine here at Presbyterian Queens. And I know plenty of people that do a transitional year. So for the applicants that are applying, there are basically three routes most people take. Obviously, some PM&R programs are categorical, meaning the first year is built into the whole program. And for majority of the PM&R programs, at least in my experience, is something called advanced program, meaning you start PM&R as a PGY2. So you end up doing your PGY 1 year someplace else. There are typically three routes people take. One is a preliminary surgery year, where you're basically a surgery intern somewhere, and then you go into your respective PM&R program. Similar to that is the prelim internal medicine year, which is what I did, where you spend majority of your time in an internal medicine floor, and depending on the program, you may do some ICU, maybe some night floats, some elective, but majority of your time will be spent in an internal medicine inpatient floor. And then the third option is the transitional year. The way somebody described transitional year to me the best is basically you're rotating from different specialty to different specialty. So you spend a few months in medicines, a few months in OBGYN, a couple of months here and there in pediatrics, and of course some electives as well. So those are generally the three routes people take in their first year before they move into their advanced PM&R program. And as far as like what like benefits and not benefits each of them have, I think if you want a very strong foundation in medicine because you see yourself potentially practicing as a general practitioner in PM&R, I think having a strong foundation in medicine is more helpful from what some of my mentors have told me. But if you're uncertain, if you want to, spend your time, majority of the time in a hospital and you're open to pain and things like that, I think it's perfectly fine to do a transitional year and kind of get an exposure in all the different fields.
All right, thank you for that overview. Anything to add from the panel?
Yeah. So I did a transitional year down here in SoCal, and I think one of the ways now that I've gone through it, the way I could best describe it is it's very similar to the way med school is, where you are going through different specialties. Of course, the only difference is that your responsibilities are a lot more. And so I personally enjoyed the variety, just because a lot of these different specialties I was in, this is probably going to be the last time I really get to be exposed to these. And so I feel like it really provided a more well-rounded experience. It depends, I think, on the TY that you end up going to, that some of them are a little bit more internal medicine heavy than others. Mine, I would say it was like maybe a third of the year was spent on the internal medicine ward side, but most of the other time was spent kind of like it was mentioned, like ortho, OB-GYN, just plenty of electives for you to kind of be exposed to whatever it is that you feel like you want before you're off to your advanced program. Yeah, so it's very similar to the way med school is in terms of the setup. So yeah.
All right, thank you. We have another question about program signals. So, should you use a program signal for your quote unquote backup programs versus your aspirational programs? How do you balance that? What was the
This
strategy?
I think this is where you have to do a little bit of like soul searching, right? And you have to be realistic about the strength of your application. Okay. For example, if you have an application that has minimal research and you're applying to PM&R programs that are extremely research heavy, it's going to be hard for them to notice your application if they're looking for research and you don't have a lot of that, even if you do signal, right? So if you're not a competitive applicant for a particular program, it can be hard to make that signal effective, right? So you need to look at what residency programs recruit students like you and whose experiences look sort of like yours, whose patient populations that they serve or interests match up with yours, because that's going to come out in the interview process and they will identify as someone that they could see being successful at their program, right? I think most people are doing some combination where there's like a few reaches, but like the bulk of their program signals are being used for programs that they think they have a realistic shot at getting an interview for and they're really interested in. I think if you used 10 or 15 signals on reaches, you probably won't end up interviewing well.
Yeah, I think to piggyback off of that too, I've had some questions from students about there's a new website, residencyadvisor.com, which is a AI powered residency site where you can actually enter your stats, et cetera, and it will kind of identify your reach and kind of standard programs and your safety programs. I think be really careful with that. We were working with our med school advisors on that, and say you're applying to plastic surgery and you put in, I've failed step 3 times and I remediated 4 classes. It'll still give you a full list of plastic surgery programs with like no advice of, hey, maybe you should have a backup plan. So I think be really careful because those tools can be helpful when used right, but it is only one tool. And so I think this is a place too where talking with your mentors, talking with your advisors about putting together what is your kind of list of kind of right sizing your programs that are aspirational, your programs where you feel really confident in, and those programs that are kind of in your sweet spot. So, I think it's a tool, but don't rely on what that list says to be your quote list, because I think that's going to risk putting people into bad spots this year.
Okay, let's jump to a couple questions about geographic preferences. How should you choose your geographic preferences if you have interest in programs all across the United States?
So in addition to the option of 3 geographic preferences out of the 9, you also have the option to choose no geographic preference, which does show up to all of the programs that you apply to. So they see that you have no geographic preference. That's okay. That's not necessarily inferior to an aligned geographic preference with a program. So that option does exist. A lot of applicants choose that opportunity when there is a wide variety of interests. And in fact, it's serves you better to do that than to leave the question blank. Leaving the question blank shows a program director maybe that you did not choose that region. So really, instead of three choices, which is either choose three regions, choose nothing, or skip the question, you should go with one of the first two. So either choose three regions or potentially say that you have no geographic preference. Many applicants are very open to many different places within the US.
I think if you fall into the latter camp where you are very open to moving wherever or experiencing a different part of the country that you haven't had like particular ties to in the past, it would probably be better to state that you don't have a preference versus be like, I've always wanted to live near mountains because I like hiking. Like in my impression, the geographical preferences are strongest when you say like I have family out in this region. Like you're trying to convince, I think, programs that you are interested in potentially staying local to that program, in conversations I have had. So like unless you have a strong reason for those areas, I'm from here, I have family here, I went to school here and I loved it. Like, think hard about the location.
Think to bring in a question that was in the chat that relates to this, I think it's important to comment on is I definitely agree with a program signal is going to outweigh a geographic signal. But then, recognize that, right, if someone if, a couple of candidates all have program signals to the same program, they all have similar board scores, similar experiences, and one person has indicated that they either don't have a preference or they have a preference for that particular region, that person will probably likely get the interview over someone that maybe either left that question blank or has a geographic preference but is not in that geographic area. And so, that is a way that you can utilize these is, you just have to be honest with yourself. Is do you truly have no geographic preference? Then put no geographic preference. If you do have a geographic preference, then put that. Just know what Dr. Romonoski just said. And her paper was put in the chat about this, and so that's how your a program is going to see these. But a program signal definitely outweighs a geographic signal, in my opinion.
The other thing that I want to emphasize, I agree with all the comments. The other thing I want to emphasize from a program director's perspective is that, a program signal is not an end all be all to getting an interview at a place, right? We had plenty of applicants signal our program that we did not interview. And just because you program signal a place doesn't mean they're going to interview you, right? Like your whole application has to match up with what they're looking for, right? Does program signaling have a strong positive effect on interview receipt? Absolutely. But it's not the end all be all. It's not the only thing programs are looking at. So, is it important to be mindful about your program signal selections and your geographic signals? Absolutely. It's one of the easiest ways for you to communicate to programs clearly about what your interests are. But if everything in your application does not speak to a particular place, just because you signal them doesn't mean you're going to get an interview. So please do not equate signaling a place with getting an interview, right?
Yeah, I think that's a good point. So one question is, so all things being equal, this is for the program directors and those who've served on rank committees. If you had three candidates, one who selected your region, one who selected no preference, and one who selected a different region for a preference, how would you rank them?
I think that if all things are equal, the no preference and the one that signaled or chose the region, will have maybe an advantage over somebody that chose a different region that is not in our program is at. I don't think having no preference, geographical preference, is a downside. As long as there is a box there where you can say, I truly looking for the best training for me or the program that fits me the best and truly don't have a geographical preference. I don't think that's gonna really hurt you, at least in some programs. And but having a different geographical preference, then it makes us question like, is this person really willing to be here? Or is this a place where that person where you're gonna feel comfortable and you're gonna be supported during your training?
And one follow-up question, because you mentioned the space you can use to describe your preferences. So, with the limited amount of characters, should you mention specific cities and states or just keep it broad when you comment on your geographic preference?
It
I would say,
depends on,
go ahead. I would say that it depends. I would say be honest. If there is a lot of cities or states in that region that you prefer and truly are interested in, then, and is in matches with your signaling, then that's a good thing. For example, I'm in Miami, and Miami is the South Atlantic region, includes a large amount of states in that area and different programs too. So it's hard sometimes for me to know. It's like, are you okay moving down to Miami, or are you looking a little bit more up north along the I-95? It is hard to tell. So, but if you are saying like, I really am looking for programs in these specific cities or this specific state, then that is going to add weight to your geographical preference. As long as you're like honest and matches with your signaling, that will play in your favor.
I think Dr. Williams mentioned this in another answer, but if you have some type of tie to the geographic preference that you have listed, I mean, put that in there, right? So I'm at University of Kentucky in Lexington, and if you have family from here and this is a region that you want, like that's going to speak volumes if you speak to that. Then if you say, well, I want to brush my hands against the bluegrass and see the rolling hills. Like, if you have a connection and a true reason why you want to be in that geographic region, put it in there. I would avoid being more specific and less generic. I think that gives that geographic signal even a little bit more power to your application.
Yeah, I'm just gonna highlight that part because as I'm being in Miami, I get a lot of the weather and the ocean. So that is like how does this tie to your training and the support that you're gonna have? So I'm not gonna lie, I chose Miami too because the weather is also nice, but that shouldn't be like you shouldn't use the characters to to use those words. Maybe give a little bit more of substance in that area.
Good point.
I would say as someone who had an unusual situation in that I think a lot of you can probably relate to. I grew up in the Dakotas, so I don't even think they have any medical schools there. So I the thing is your program directors and your future colleagues, I mean, they can smell insincerity a mile away. So no matter what you say, just make sure you can speak intelligently to it. So for me, a lot of it was, hey, this is how doing an audition, living here for a month in this post, this is how it changed me, changed my perspectives. For, for the state of California where I ended up, a lot of what I had to say was, hey, here's a specific civil rights movement that is really important to me that I want to contribute to, and I think will have an impact on me. So as long as you can be honest, I think that's the main thing.
Okay. Um, it is 7:30, so we're going to jump into meaningful experiences, but we can always come back if we have time at the end. So should one question about meaningful experiences is should the three most important experiences be PM&R related?
I would say it doesn't have to be PM&R related. We want to know who you are. We want to know your character. We want to know what experiences build that person, that you are going to be there. We want to make sure that we are able to provide the training that you're looking for. And we're also looking to make sure that you're a very good fit for the culture and the training of the program. So, and the application is a way for us to get to know you better. So it doesn't have to be PM&R related. Of course, if one of your meaningful experiences or a couple of them or all of them are PM&R related, that's okay. But it doesn't have to be.
Absolutely. Much like signals, the meaningful experiences are your opportunity as an applicant to showcase who you are and what's important to you. So think about what has been meaningful and be authentic. Maybe that's a clinical experience, maybe that's research, maybe it's community service or something that you did maybe years ago. It doesn't have to be something completely related to PM&R. So it's your opportunity to show us something that's different than your scores and your rotation evaluations, things like that. So it's another opportunity just to really be honest with yourself. And so I encourage you to do some reflection and think about how you want to use those.
Those are also things that are very frequently touched on in the interviews. So just make sure that they're things that you're comfortable expanding on and talking about, because I think those were very frequently brought up. And, realistically, I think you can get something PM&R out of many experiences because this is like a quality of life specialty. And there's something that you can kind of pull from anything to make it applicable. And like we look at our patients as more than just their condition. So your program should be looking at you as a human too. So I think those questions are a lot about trying to determine if you'd be a good fit and if your like values are good for programs. So that's how I used mine.
As you're, I think a term that's been used a lot is, being, true to yourself or really thinking about yourself, a lot of self-reflection. I think when you go through this process and you fill out your application, you need to answer what are the most meaningful experiences to you, not what does a program director at blank program, what are they going to think is meaningful? Because I would way much rather know what is meaningful for you if it was even predated medical school, which is one of the questions in the chat. If that meaningful experience made you who you are today, I would much rather that than maybe a single Saturday 2-hour volunteering experience that probably was really good, but maybe it wasn't as meaningful as that experience before your med school journey. And so really think when you're going through this, what is meaningful to you, not what do I think is meaningful to a program director reading.
Yeah. I mean, it sounds like be authentic, right?
Yeah, I was gonna just echo that. One of like my mentors was really helpful, and one of the pieces of advice they gave me was whenever you're in doubt of like what to put on an app, always lean towards the honesty side rather than the trying to be strategic. Because it's really easy to like read all these Reddit posts and all these things that people are doing, and you want to be as strategic as you can when you're applying. But being honest is like definitely going to shine through way more than your strategy or whatever it is that you're trying to go and trying to manipulate the way the match goes and stuff like that. So I think it's just important. Like I know everyone mentioned it, but whenever there's a part of your app that you're kind of unsure of the direction to take it, leaning towards honesty is like definitely the way to go.
I wanted to touch base a little on a question about in the chat about the meaningful experience and for IMGs. Because they're saying whether or not including the shadowing or clinical activities goes in that category. You also have your CV to put these type of rotations, and there are other places that you can expand on it. Doesn't necessarily means that in your meaningful experience you have to put the rotations that you did in the US. Saying that as a program director, as an IMG myself. So it is, don't feel that you have to demonstrate those rotations. We see the entire application, and we can see like when in the CV or other areas where you rotated at. So take advantage of that also to show who you are as a person. And for example, in my case, like coming and moving to a different country, how that shaped you into that. That could be a good opportunity to talk a little bit about that. So don't feel that you have to put that the rotations in there.
And kind of a follow-up question or related is, you thinking about your meaningful experiences, should there be an even distribution of leadership, advocacy, research, and academics, like one per domain, or how would you approach that?
I think if you can have that differentiation, that's great. But I think it's kind of echoing to what everybody else said before. It truly is your most three meaningful experience. If your most three meaningful experience all came from something PM&R related, well, that's who you are. If your three meaningful experience came from something non-PM&R related, well, that's the most meaningful experience to you. Kind of going back to, I remember interviewing with the current program I'm in, and I don't remember actually having a single discussion about, my, like my experiences in PM&R up to that point. The question Dr. O'Park had asked me was at the acting program director at that time is, tell me a little bit about this health literacy class you ran in Harlem, which is where I went to medical school. And that was basically 15 minutes of our conversation. So I think it's kind of echoing what everybody else is saying. It really is your opportunity to kind of show beyond who you are, other than the grades and the research and things like that, and kind of talk about what makes you unique and what makes you potentially the right fit for that program.
One question that has come up is kind of how far back would you go for a meaningful experience? Are we talking all med school, college, high school? How far back?
No time limit.
Yeah, I would say this is very contextually dependent, right? So, like, if, for example, you were an Eagle Scout, that means you started doing Boy Scouting when you were like 7 or 8 years old, right? So, talking about the fact that you started Boy Scouting when you were 7, 8 years old and then became an Eagle Scout, when you graduated high school, that would be very appropriate. I don't think anyone wants to hear about your, you know, first place, um, science poster in the fifth grade about how bees make honeycombs. So try to make it relevant to like your, accomplishments that are relative to your medical education and your training going forward. That being said, if you're coming to medicine as a second career and you have employment experience, managerial leadership experience, in the last 5 or 10 years, you should highlight that because it's part of your story. So I don't think, like Dr. Molinares said, there's no absolute cutoff. Right? It's extremely contextually dependent, depending upon where you're coming from and what your story is.
Does anybody want to give an example of something good and something bad that would go in the meaningful experience section without betraying trust of any previous applicants?
Good, meaningful experience would be the 3 summers that you spent volunteering for um, Special Olympics, right? Bad, meaningful experience would be the required 10-minute presentation you did on your internal medicine rotation in your MS3 year.
Those are great. Any other examples here? Sounds like something longitudinal, meaningful, above and beyond something that changed you, not something check the box, right? One question was, can this section be a repeat of something that was mentioned in my personal statement, or should it be something novel?
I'll tackle that. I think uh, it can really depend if you're trying to elaborate or you're really trying to pull a thread of this is who I am, these are the values, this is who I want to be professionally and where I want to be. I think those things tend to show up in both the CV and the personal statement. But I think that it needs to kind of tie a thread. I think if it's more of a your personal statement is a summary of your CV, I think that's where your statement can kind of fall short because I think, at least from my perspective, I think those most powerful statements are the here's confidently who I am, here's how I got here, here's who I want to be, and what I'm looking for in a program to help me get there. If I can see those things in a personal statement, then it gives me a really good quote read of who you are. And to that question of, is my program set up to get you where you want to be? Certain programs are going to be better or less suited for particular types of residents, types of careers. And so it allows us to kind of feel out, hey, from our perspective, just academically, where we can take you, are we the right fit for you? There's all of the kind of personality, geographic region, kind of cultural aspects to a program. But I think just academically, can we get you where you want to be? I think the CV and the personal statement tie together pretty frequently that way.
Yeah, when you're creating your personal statement, it is the one opportunity that you have to really tell us about who you are and your characteristics and who you are as a person. And so, if those experiences relate to that in your story to how you got into PM&R and, your career path, then absolutely you can bring that in. But you should not, as Dr. Lamm said, utilize that space in your personal statement as a regurgitation of your experiences. That's why you have an experience section. I don't think that is the best use of space in your personal statement to just regurgitate two things. So focus on, who are you and what are things like why are you pursuing PM&R and what do you see in your career plans and what are you going to bring to a residency? And then in the experiences, what are important to you and what do you want to tell us about yourself? But the personal statement is really unique in that fashion that you can tell us anything and everything.
Yeah, and just to like add, so I guess like one way to view your app is kind of a story, and like from start to finish, it's just one continuous story. And of course, if you're trying to tell your story, you don't want to double up on something that you've already mentioned earlier on in an earlier chapter. So if it's going to add to it and supplement it and make it a little bit stronger, well, then albeit go like, of course, go ahead and do it. But if it's a matter of you just like answering the question for the sake of answering the question, because that's what's required, then that's where you're kind of wasting that like valuable spot to showcase a little bit more about yourself, and adding to your story.
Okay, from the panel, well, before we move on to more general questions, any last thoughts on program signaling, geographic preference, or meaningful experiences? Something you wanted to say, but we didn't get a chance to get to it yet.
I think there was one question in the chat that was partially addressed. I think the question asked more about the formatting of the experiences, about a paragraph or a bullet point. I think you're probably going to get different answers depending on who you ask. I'm a bullet point person because I think it's really easy to read that way. When you get into a paragraph, I feel like sometimes if you're a little too wordy, it can lose some of its impact. But again, I think you're going to get different answers. I'm a bullet point person.
Short and sweet.
Agree.
And a kind of related to that, this is a question that was submitted tonight. With 500-ish applications and 50-ish interviews, we do the math. How do residency programs make that huge cut? What do they look for when they decide who to interview? Program directors, what's your magic formula?
I think that everybody has, of course, a different way to do it depending on their resources that they have in terms of like how many people are reviewing the applications and things like that. Um, program signaling and uh, geographic preference has helped us a lot. Most now with 20 signals in the statistics, I think somebody put it in the chat too. The chances of you getting interviews are gonna be significantly higher for those in those 20 programs that you signal than the program that you didn't signal. So that plays a big role into the equation of how we kind of like tease out who is really interested in the program and who may be interested in some other program, not necessarily ours. The in our program, the review is very holistic. I truly like go through every single one of the applications. And in our program, we're looking for somebody very balanced. So we are looking for different aspects of things. So we have a group of people that we sit on the round table. Somebody's opening the MSPE, somebody's opening the experiences, somebody, and so forth. And then based on that, we kind of like get to a number that goes then to the uh, recruitment committee and then get scores on different aspects of the application. So, but everybody's different. What I would say is that it's a common denominator now with the 20 signals is the signaling. Because if we can get in our case, right, we interview between 80 and 88 applicants, and we get, let's say, 300 signals and 600 applications, then if those 88 come out of the 300, then I'm gonna prefer somebody that uses signal because it's very interested in the program versus somebody that is interested in other 20 programs over our program, because then it wouldn't look like it's a good fit. So I would say the signals play a big role.
Unfortunately, there's no perfect algorithm for how any of us do it. There's a lot of different opportunities on your application to really showcase who you are. As an example, in my program, we take 4 residents, but I don't want 4 of the same residents, right? We're looking for maybe different things where we can bring different skill sets to our program. So your application is really your chance to really show us what sort of skill sets you might be able to bring to a program.
Some of the things that stick out might seem, really silly, but actually reflect sort of what Dr. Romonoski and Dr. Molinares have already mentioned, right? Programs are looking for you to positively contribute and have a good experience while you're there. And part of that includes not only your affinity for the program, but how you grow and mature in that particular area, in that geographic setting, right? Whatever ways you may contribute to that program. The example that I love to give on this topic is we're in Houston, right? We're on the Gulf of Mexico. It is, very, very hot and humid. The temperature and the humidity are the same right now. It's lovely, I promise. Uh, but if someone grew up in Minnesota and they grew up skiing on like junior national teams their entire life, and they talk about how important skiing is to them, what are the odds that they're going to come to my probably low, right? They love the snow. They want to stick around places that
You
have that
never know.
as a way to like hang out and play because like things that they enjoy, things that they're drawn to, like we don't have snow in Houston. So you're right, Dr. Romanowski, you never know. But like that would give me pause as a program director. So, like others have mentioned, it in PM&R particularly, it really is about the sum of the parts, right? There's no one individual cog or gear or star that's going to make you amazing to everyone, right? Different applicants are going to shine to different programs in different ways.
So I agree with everything that has been said. The one thing that I will add is, if you make things like your personal statement to have some specificity and make a program specifics personal statement, if that is what you decide to do, please make sure that you are sending things to the right program, right? I'm in Lexington. And when I read a personal statement that says I would really want to spend my time in Louisville, Kentucky, I'm going to say that's awesome. I know a lot of the folks there. Then that person, they want to go to Louisville, not Lexington. So just please make sure that you are proofreading if you do decide to make things program specific, because that's going to really speak volumes and probably warrant that person, if they were going to get an interview, it may not completely drop them out of an interview, but it's going to look negatively if you're sending program specific things to the wrong programs.
Yeah, 100% agree there, especially with the rivalry between those two cities. Um, I think with that too, if you're sending any letters of interest to program directors or program coordinators, be careful of the same. A lot of times the emails that come through, the whole email is like Times New Roman, and then the program name is in Arial or something else, and it becomes really obvious that this is a form email that's getting sent to a lot of places. So the advice that I give students is if you're going to send a letter of interest, I don't think that you have to, but if you're going to, make it specific and make it for that program. If I can put Mary Free Bed in there, or I can put University of Kentucky into that sentence and it still reads the same, then it's not really specific to our program, right? It reads generic, and I don't think that that helps you.
On
Yeah.
that, sorry.
No, it was something similar. Sorry about that. It's also very important that it's not a copy paste from the website, or like it sounds exactly like we say it, because yeah, it may be that you're interested in like the ultrasound courses that we have, or like the spine courses, but if you like just kind of like looks like you just copy it from somewhere else and just paste it into that blank, also doesn't read genuine. And I think that's the theme of the whole thing, the whole night, is that we have some experience reading these statements and letters and emails, and sometimes some of them we are not able to pick up, but we are pretty decent at realizing when something is not genuine, or is a copy paste, or is the same plus or minus some edits, and that instead of helping you, it probably will hurt you. It won't be neutral. I think in most cases will hurt you, consciously or subconsciously.
The only thing I was going
I'm
to
laughing because when I was program director, that happened a lot. I wrote the website because I wrote the content, and then people would copy paste my own words and send them to me. I'm like, oh, this sounds great, except I wrote this, you didn't.
the only thing
Yeah,
that I
the
think, oh, sorry.
I was just to sorry, Nick, just to echo what Dr. Eickmeyer said. I've seen people like name drop in their personal statement, including the name of the program director. I don't want my name in your personal statement. I want you in your personal statement, right? You just look like you're sucking up way too hard. It's not a good look.
I was just going to add, please use AI with caution. I think there is certainly a way to utilize it for, grammar stuff, what have you, but please do not put, I want to send a letter of interest to blank program. It spits out something and copy and paste. Again, I think it is actually going to be a challenge for everyone in the field of trying to determine what is authentic, what might be AI generated. We actually had a big discussion about this in clinic this week. And so just, be authentic, be genuine, but please don't rely on AI.
Yeah. Anything too with personal statements, the thing I'll add to that, to everything that's been said is it's your chance to sell us on you. Don't sell us on PM&R. We've all picked it already. And if you do that, you're wasting valuable column inches that could have been spent telling us more about you. And I'll sit there and finish reading it and say, gosh, what's here is pretty good. I just wish I had more. So if you're going to talk about the field, talk about how it resonates with you as a person and your values and experiences, not just you like the patients or you like the procedures or those types of things. Really connect it to you if you're going to go that route.
Okay. Probably time for one more question before we have to sign off. There was several questions submitted tonight asking about people who discover PM&R late. You're not alone. What's the best way to incorporate previous meaningful experiences, previous non-PM&R activities, and weave this story in your application when you just found out about PM&R at the end of your third year? I don't know, did that happen to anybody on the panel?
So I found PM&R very, very, very late, many years ago before signals and away rotations and all those things. But again, the application doesn't have to just tell us what PM&R is, to Dr. Lamb's point, right? So what is it about you and your future as a physician that makes you a good fit as a physiatrist? And that's what I want you to think about. Is it your leadership? Is it your communication? Is it your research? It could be a number of different things. Those are just examples. So really remember that you're applying for a residency as a future physician, not just trying to play a game, right? This isn't just a game of where can I match and who can I try to send a signal to. Yes, those are things that you have to consider, and I understand they're incredibly stressful. But if you can kind of take a step back and think about what kind of physician you want to be and why that's a good fit, you'll find things to put in your application that match that.
I wanna highlight the fit part because sometimes you can see a program that maybe, rank really high by certain ranks or be excellent on paper, but that doesn't really mean that it's gonna be a good fit for you. And I can guarantee that if it's a good fit, you're gonna have a very good experience, education, and growth in a program that is very good for you. And I wanted to say something else, but now I forgot about. It will come back to me, and I'll tell you. But yes, the fit is very important.
One thing that I want to say about applicants who come to our specialty, finding it late, we as program directors understand that not every medical school has a PM&R department. We understand that many areas do not have physiatrists that do teaching, right? That does not have to keep you from being successful into matching into our field. I hope that you guys are seeing a common thread in what we're saying, right? That there's no magic formula. It's not like if you do 2 away rotations and this many poster publications, right? And you did this many hours of volunteering, you're going to match, right? You could easily get surpassed by other applicants with like way less quote unquote credentials, who were true to themselves and like loved the specialty. And that came out in the interview process. So do not let the fact that you don't have a home program keep you from being successful. You have to demonstrate your knowledge and awareness of the field, but there's a lot of ways to get involved in national organizations, virtually or remotely, right? Or there's even ways to get involved in disability organizations in your local community, where you're going to meet people who will have been around a rehabilitation environments and you can start to learn about the specialty and that speaks to your interests. So it doesn't have to be the classical, I did a PM&R elective and then I did 3 when I was a MS4 and all of these things speak to PM&R, right? there's plenty of quote unquote non-traditional applicants or histories in our specialty.
Sorry, and I remember what I
Okay.
was gonna say that is that we wanna make sure if you come late, we wanna see that you really have a good grasp of the field. Like you understand what you're getting yourself into. That we wanna make sure that you know what is PM&R is all about. And that doesn't mean that you have to do a lot of different things. It's just understand and making sure that that is the physician that you wanna become a physiatrist. So that is the key element about being finding PM&R late.
Well said. Okay, thank you all so much. We are a little over time, so I want to thank our esteemed panel, appreciate everybody's expertise and experiences, and stay tuned for more advice coming to you. So thank you all very much.